Which of the following is the most commonly reported neurologic complication following prolonged DHCA? A. Seizures. B. Blindness. C. Stroke. D. Delirium or cognitive dysfunction. Answer: D. Delirium or cognitive dysfunction. Explanation: while stroke and seizures can occur, postoperative cognitive dysfunction and delirium are more common. These effects are usually transient but can be prolonged in elderly or high-risk patients. Which of the following cerebral perfusion strategies during DHCA provides the most physiological antegrade flow? A. Retrograde cerebral perfusion via SVC. B. Cold crystalloid cerebral flush. C. Direct cannulation of carotid arteries. D. Femoral artery perfusion. Answer: C. Direct cannulation of carotid arteries. Explanation: selective antegrade cerebral perfusion via carotid cannulation provides physiological forward flow, maintaining cerebral perfusion during prolonged DHCA and enabling longer safe arrest times. Which of the following is true regarding glucose control during DHCA? A. Hyperglycemia is protective during hypothermia. B. Insulin is never used due to hypothermia. C. Hyperglycemia worsens neurologic injury after ischemia. D. Glucose levels are not relevant during DHCA. Answer: C. Hyperglycemia worsens neurologic injury after ischemia. Explanation: hyperglycemia leads to increased lactic acidosis and free radical damage during reperfusion, worsening neuronal injury. Blood glucose is tightly controlled during and after DHCA. Which of the following best explains the neuroprotective mechanism of hypothermia during DHCA? A. Increases synaptic transmission. B. Enhances ADP consumption. C. Reduces cerebral metabolic rate and oxygen demand. D. Promotes cerebral vasoconstriction. Answer: C. Reduces cerebral metabolic rate and oxygen demand. Explanation: hypothermia significantly reduces CMRO2, cerebral metabolic rate of oxygen, lowering ADP demand and preserving cell viability during periods of circulatory arrest. What is a common early postoperative complication following prolonged DHCA in adults? A. Hypertension. B. Spinal cord infarction. C. Coagulopathy and bleeding. D. Pulmonary embolism. Answer: C. Coagulopathy and bleeding. Explanation: due to impaired platelet function and clotting factor activity during profound hypothermia, coagulopathy is a frequent early postoperative issue after DHCA. Which of the following monitoring modalities provides real-time cerebral oxygenation assessment during DHCA? A. Bispectral index, BIS. B. Transcranial Doppler, TCD. C. Near-infrared spectroscopy, NIRS. D. Nasopharyngeal temperature probe. Answer: C. Near-infrared spectroscopy, NIRS. Explanation: NIRS allows non-invasive, continuous monitoring of regional cerebral oxygen saturation, offering insight into cerebral perfusion adequacy during DHCA. Why is rewarming limited to a rate of 0.5 degrees Celsius per 3 to 5 minutes during DHCA recovery? A. To prevent vasoconstriction. B. To avoid cardiac arrhythmias. C. To reduce the risk of cerebral hyperthermia and embolism. D. To promote diuresis. Answer: C. To reduce the risk of cerebral hyperthermia and embolism. Explanation: slow rewarming helps avoid thermal gradients, microemboli, and brain overheating, which could reverse the protective effects of hypothermia. During DHCA, why might retrograde cerebral perfusion, RCP, be used in addition to hypothermia? A. To provide myocardial protection. B. To deliver cardioplegia. C. To flush emboli and maintain minimal brain perfusion. D. To reduce CSF pressure. Answer: C. To flush emboli and maintain minimal brain perfusion. Explanation: RCP, via the superior vena cava, helps flush out air or embolic debris and may provide limited cerebral perfusion, acting as an adjunct during arch surgery. Which of the following is an appropriate target nasopharyngeal temperature for initiating DHCA? A. 30 degrees Celsius. B. 25 degrees Celsius. C. 20 degrees Celsius. D. 15 degrees Celsius. Answer: C. 20 degrees Celsius. Explanation: the standard temperature for initiating DHCA is around 18 to 20 degrees Celsius, where cerebral metabolic demand is significantly reduced and safe circulatory arrest duration is maximized. Which of the following statements about selective antegrade cerebral perfusion, SACP, during DHCA is true? A. It eliminates the need for hypothermia. B. It enables longer safe arrest times compared to DHCA alone. C. It is only used in pediatric cases. D. It increases embolic risk compared to retrograde perfusion. Answer: B. It enables longer safe arrest times compared to DHCA alone. Explanation: SACP allows extended arrest times by providing continuous oxygenated blood to the brain, typically used in ARCH procedures lasting longer than 30 minutes.